Welcome to the StantonMD show. I'm board-certified emergency physician Dr. Ryan Stanton. In this episode, we talk about a growing problem that involves insurance, healthcare, and access to emergency medicine. The emergency department represents the primary site for the stabilization of unstable and emergent conditions, as well as the safety net for our healthcare access of millions of Americans. There's been a great deal of debate, angst, and opinions on the finances of healthcare, but it involves big dollars, corporate interests, and in many cases, profiteering. There is a saying that the one holding the purse strings makes all the decisions. In our system, that often means the government and private insurance companies. These groups are the primary payers of our system, serving as the middleman between the patients, taxpayers, and those that provide care. In 2015, one of the largest insurers in the country, Anthem, decided they were going to develop and grow a program that they said was an effort to deter the non-emergent use of the emergency department. Their PR education was that the ER was too costly of a care source for non-emergent problems. Their solution was to determine after the patient had gone to the emergency room whether it was an emergency or not. They would then deny the claim and have the bill sent to the patient, stating their visit was non-emergent and never should have been in the ER. The rumor was that the program started in Kentucky in 2015, but no denials were seen until mid-2017. When Anthem actually started denying claims in 2017, they started in Missouri, Kentucky, and Georgia. Unfortunately, they didn't do any education prior, had a list of denial codes that were secret to the providers and patients, and had diagnoses that clearly had emergent potential. As the program has grown, thousands of claims have been denied, and customers are being faced with thousands of dollars in medical bills, uncertainty, and the fear of the emergency department. In this episode of the StantonMD show, we sit down with 3 women that had their claims denied in 2017. We hear their stories, their fears, and how they see this impacting their futures and the futures of others. We start off with their stories. Allison Wren, Brittany Cloyd, and Kimberly Mesh all thought they had an emergent, potentially life-threatening condition. They all went to an emergency department sometime in 2017. They all have Anthem and all had their claims for coverage denied. In a program that Anthem states is only there to deter clearly non-emergent visits, these 3 women show a program that puts profits over patients. We begin with Brittany Cloyd, a 27-year-old wife and mother from Central Kentucky who presented to Frankfort Regional Medical Center with extreme right lower abdominal pain and fever in 2017.
I started out the night before I went to the hospital with some really bad lower right side pain. Didn't think a whole lot of it, so it was maybe like a level 3, 4, it wasn't too bad. Went to bed, eventually had a lot of trouble sleeping, and it progressively got worse. Woke up the next morning and was definitely not feeling up to going to work, so I called into work, and the pain continued to worsen. Got really nauseous, had no appetite, and then eventually decided to take my temperature just kind of on a whim. I didn't really feel feverish, took my temperature, and it was over 102.
Appendicitis is often a surgical emergency characterized by abdominal pain, often starting around the belly button and then eventually down to the right lower quadrant. It also can have fever, nausea, vomiting, and decreased appetite, many of the same symptoms experienced by Brittany.
So called my mom, who has a little bit of nurse training and also a lot of mom training, and she said, "You need to get to the ER now, I'm coming to pick you up." And I said, "No, I'm sure it's fine." She's like, "No, that sounds like appendicitis. You need to go to the ER and make sure everything's okay." She said, "That's the exact same thing that happened when my appendix ruptured when I was younger, the right side pain, the fever, the nausea, that's your appendix." So she came and picked me up. We went to the ER. As soon as we got into the ER, the nurses at the front station seemed very concerned and took me immediately back to a room and got tests running and going, and we went from there.
Her final diagnosis was pelvic pain of unknown etiology. In fact, a clear answer is only found in about 50% of abdominal pain cases that present to the emergency department. The next case involves Allison Wren, a wife and mother of 2 sons that lives in Lexington, Kentucky, and presented to Baptist Health with severe right lower quadrant abdominal pain, which she states had her doubled over in her kitchen floor.
It was the middle of the summer, and I was home. I'm a stay-at-home mom with my 2 kids, and it was a Friday. We were just having a lazy morning, and they asked if I could make waffles. So we were making homemade waffles, and just instantly, I was just in really horrific pain all in my abdomen, where I was actually ended up down on the floor. I thought I was going to pass out, so I kept calling my husband, at work, and he rushed home really fast. And we kind of waited probably about a half hour for the pain to subside, but it didn't. So at that point, I called a friend in the neighborhood who I knew was a physician's assistant, and she kind of urged me to go seek treatment at the emergency room.
Allison was eventually diagnosed with a ruptured ovarian cyst. Our final story involves Kim Pfister-Mesh, a wife and mother also from Lexington that presented to an ER with severe headache and elevated blood pressure.
It was the evening, and I started to get a very bad headache. So I took some ibuprofen and put cold compresses on my head. As the evening went on, the headache progressively got worse, up to the point it was 2 in the morning, and I woke my husband up telling him that I had a severe headache. We checked my blood pressure. It was extremely elevated. So I took some more Tylenol and put more cold compresses on my head. And then by 4 o'clock in the morning, the headache was so extreme. It was like the worst headache I'd ever had in my life. I thought I was going to have a stroke.
The worst headache of life is a huge concern to emergency physicians. This is one of the big tip-offs for bleeding within the brain and is something that really concerns those that work in the emergency department.
So I asked him if he would take me to the emergency room, and he did, and was seen right away. Blood pressure was extremely elevated. My head was just pounding. Again, I thought I was having a stroke. They immediately did a head CT, administered some pain medication, and came back to tell me that they wanted to monitor the blood pressure, and they got the information back from the CT and said that I had bacterial mastoiditis. I was prescribed an antibiotic and sent home about 8:30 that morning.
Bacterial mastoiditis is an infection of the area that sits behind and around the ear. It requires antibiotics and causes severe pain. It can also cause significant complications including facial paralysis, brain abscesses, meningitis, and hearing loss. Kim's husband, Daryl Mesh, also had significant fears for his wife's health and safety.
The headache was so severe that we couldn't wait. We were both really afraid that she was going to stroke, and there was no place else to go.
I thought I was going to have a stroke.
Yes, she came down and said that she can't wait. She's
Couldn't bear it any
couldn't
longer.
bear it anymore. And she tried. She was a trooper from midnight on. She tried to wait it out to where we could go to
My
regular
primary care doctor in the
the next
morning.
morning, and it just wasn't gonna. She just couldn't last it out anymore. She was just.
I really thought I was going to have a stroke.
Uh,
I said, I either am having a stroke or
an aneurysm.
I've had an aneurysm, because this pain was pain that I have never felt before. It's never been, it was so intense. I was shaking. The blood pressure was so elevated. And I told him, I said,
It was elevated
it's
because of the
bad.
pain.
I said, it's bad. We need to go.
Coming up, we talk about how they reacted to the denials and how it has impacted their lives. More StantonMD coming up. Stay with us.